SERENITY study was a trial that was looking at older patients with hypertension and looking at aggressive or more intensive blood pressure lowering compared to less intensive blood pressure lowering. And unique to this trial is they did measures of white matter intensity by MRI at baseline and at follow-up. And so they enrolled 200 patients, approximately 100 in each arm. The average age was about 80, and showed what they did was they demonstrated that it was feasible to get blood pressure to 130. The other group was above 140. Followed them for 3 years with intensive medical therapy, showed no increase in fall risk between the two groups, which is important because that's always a concern of lowering blood pressure in elderly patients. And they showed a significant reduction in white matter intensity on MRI by 40% in the intensive medical therapy arm. So I think this trial is extremely important because there's still concern about the current blood pressure guideline recommendation that those people over the age of 65, it's safe and recommended to get their blood pressure to 130 over 80. But the elderly can be frail, they can have lots of comorbidities. Providers are often concerned about driving blood pressure lower, thinking that they're going to increase fall risk, that they're going to have adverse events. This trial actually showed a significant reduction in cardiovascular hard endpoints, which they didn't expect, stroke, MI, hospitalization. So that's extremely important. They got blood pressure lowering, they were able to maintain it. It was labor intensive, the investigator said, which you can appreciate, and they had this reduction in white matter intensity. Now they did not see as much improvement in cognitive function as they anticipated. The authors felt like the follow-up wasn't quite long enough to do that, and I can appreciate that in an 80-year-old participant who you've only made a change for 3 years for something that's been a long-term process. Hypertension, it started yesterday. It's a lifelong sort of vascular insult and process. So I think this sends a strong message that blood pressure lowering in 80-year-olds is feasible to do. In this cohort, again, you can show that you can do it without increasing fall risk, and you can reduce cardiovascular events. So I think it's a strong clinical message for folks. The previous targets and the currently non-revised guidelines out there for NICE and some of the European guidelines are higher blood pressure targets for the elderly. And so the AHA-ACC guidelines are pushing people to be more aggressive. And I think as providers, we tend to look for reasons not to go to guideline. I think they're going to fall. I think they're frail. I think they can't tolerate this. And I think that what this says is you can do that. And we have to push ourselves to say, we have to personalize hypertension therapy in the elderly. We do have to look at the comorbidities. How frail are they? Is there really a fall risk? I mean, fall risk, what we think of fall risk is you have to fall about 30 or 40 times, really. The data would show you that to have a bleed and have a really adverse event. Falling down on one knee isn't really a fall risk. And so we sort of overemphasize potential. And that's our job as providers. We want to give safe care. But when you see those kind of cardiovascular risk reduction, wouldn't you rather prevent a stroke than a scab knee? And so I think it sort of pushes us to think the guidelines are they're not doing this willy-nilly. There's data behind them. And this is additional data to say that you can lower blood pressure in the elderly safely, and you can get additional risk reduction, which is what we care about, and there's a signal that we can improve cognitive function. Because I say this often, you want to go into heaven sliding into the pearly gates on your knees going, whoo, I'm done. You do not want to hobble in a wheelchair or with a walker. And so we know that therapy will improve cognitive function. Don't you want to know that you got there? And so I think these signals that there is opportunity to slow down cognitive decline is extremely important, and they showed that with blood pressure, better blood pressure control in the elderly.